In Mindpax, we are tackling and trying to predict the relapses of the most severe psychiatric disorders, which is schizophrenia and bipolar affective disorder. Why is it so pressing? Because there are 100 million people suffering from these two diseases worldwide. There is no new medicine available for the last 20 years. The current approach to predicting the relapses or attacks of these diseases is done in the interviews with the physician only 2 times a year, and the overwhelming costs are 800 billion euros annually worldwide. How we do it? We have designed a long-term monitoring system which is monitoring sleep, physical activity, and subjective feeling of the patients. And based on these data, we are creating a digital biomarker, and the variations of this digital biomarker are giving us the information on the relapse. We give this information to the physician, and he can adjust the medication, basically avoiding the relapse and hospitalization whatsoever. How do we know that it actually works? We have gone through a randomized clinical trials that has been supported by Eli Lilly, and we proved that we can decrease the hospitalization of schizophrenics by 80%, and we can predict the relapses 6 weeks before they actually happen. The system for schizophrenia is already in the clinical practice. For bipolar, we are now running a large-scale clinical trial, 400 patients, 18 months. We already have some preliminary results which show that the sensitivity of our algorithm is over 80%, and the compliance rate of the patients is extremely high. For the psychiatric patients, 90%. Our target market in Europe is 21 million patients, out of which roughly 10%, according to our clinical experience, are the people that are ready to take over the digital solutions in psychiatry. And based on our pricing, which has been discussed with the main health insurance companies in Germany, we are looking at a potential revenue from Europe of 1.5 billion euros. Our way to commercialization, we need to finish first the clinical trials in Germany and get the certification 2A, which are a clear follow-up from the results from the trials, and then we will enter the integrated care model together with the Techniker, the major health insurance company in Germany. What is so special about Mindpax? We have designed the system from the beginning as a psychiatric one. We are not monitoring any intrusive communication or mobile phones, which is doing most of our competitors. And so far we have been able to collect the biggest commercially available longitudinal database of data for bipolar disorders. Who is the buyer? Apart from Eli Lilly, we are closely cooperating with Lundbeck and Otsuka on designing the follow-up clinical trials. With the German clinics, we are doing the design of the studies, and they will do the studies together with us. Now we are raising 3 million euros. So far we have raised 650,000 for building up the system and for the initial trials. From these 3 million, our current investors already pledged to invest 700,000. And our team is a mixture of clinicians, IT specialists, and finance people. If you like what we have heard, I will be very happy to have you on board and help us to do this life-saving exercise with us. Thank you.
You're trying to address in the mic. I think I have one here. It's already activated. Yes. You're trying to address a very big problem, and you made a very bold statement because you're claiming you predict the schizophrenia. But could we know a little bit more about the science behind it? Because could you clarify which were the clinical endpoints that you used, the statistical power to support that claim? Because that will be indeed very important for deciding an investment.
Yes, the relapses with both of these diagnoses are somehow related to the circadian rhythmicity of these patients. So basically the synchronization of the sleep and physical activity of the patient and the life. So basically what we are doing is trying to understand if there are any differentiations between what is the circadian rhythm of a healthy patient and of the diagnosed patient. And if we can collect the data for a very long time, we just find the variations, very small variations, which can predict that relapses about to occur.
What was the clinical endpoint that you used? Was it the episodes diagnosed by a physician?
So are you asking on the design of the study?
Yes.
Yes. So it was basically one part of, or one group of the patients have been treated as normal, so the relapses have been predicted only on the discussions with the physicians, and the other part was treated with our system, and the relapses have been predicted with the subjective questionnaire and our system. And when comparing these two, we just came to a statistically significant result that it's much better using our system than the current approach to predicting relapses.
Can you clarify a bit deeper? You shared the engagement factor when you started. How many people was this on?
On the first clinical trial, or overall?
Well, your first slide said you had an engagement factor of X, and I'm wondering.
Yes.
What population is that?
Yes.
In this case, it will be important.
So, for schizophrenia, as I said, it's being used in the clinical practice. It's currently used by 500 patients. The clinical trial was based on 30 patients and 30 control groups. For the bipolars, it's in the stage of the clinical trial, which is 400 patients. But in comparison to other research trials, it's extremely large, because the competitors, what they are doing is typically 15 to 20 bipolar patients monitored for 2 or 3 weeks. We're doing 400 patients.
This study, I think it's a little bit preliminary. I think the important one is the second one that you're conducting right now, because the N is very small to really have statistical power.
Yes, on the other hand, there are no other clinically validated approaches for predicting relapse in schizophrenia. So we have at least some proof that it works. And
signals efficacy that it works, but it's not definitive.
It's not definitive. That's why we are now applying for a grant in Germany on our home market, together with the research institutions there, to do a larger scale study to prove it. And we are designing the study together with the health insurance companies and the pharma companies to have the results stronger.
Last question, please.
So who do you see as your biggest pool of competitors? Because there are a lot of mental health behavior modification companies out there. This has a slightly different approach, because it's looking to predict relapses or recurrences. So who do you see as your competitors?
Well, basically, there is as you said, there is a huge number of potential competitors that are looking into depression. We are not looking into depression; we are looking into the most severe things. So. Our key competitors in Europe would be a Danish company, Monsenso, which we're also somehow cooperating with, and US-based Mindstrong, which we are linked to through our US-based investors. So these two companies we consider the biggest competitors of also potential partners.
Thank you so much.